And we turn to China now, where COVID-19 curbs are being relaxed following some of the biggest displays of public anger in decades. Residents in Beijing and beyond have been welcoming the first signs of normalcy after years of tough restrictions. On Saturday, authorities began dismantling some of the testing facilities in the capital. However, they insist that they're not abandoning the country's zero COVID policy, just implementing it more flexibly.
In the southwestern megacity of Chongqing, life is beginning to return to normal. Shops are open and residents are back on the streets. Just last month, many of its 32 million inhabitants were under lockdown. But now authorities are relaxing COVID rules across China, even as infections remain near record highs. In several major cities, testing requirements for buses and other public transport are being dropped. In Beijing, authorities have been closing test sites, leading to long queues at those that remain open, as tests are still required to access many public spaces. Despite the frustration of a long wait, many Beijingers are enthusiastic about the loosening of restrictions.
I feel that the controls are looser than before, and everyone is eager to go out. Everyone feels more relaxed.
Now, with rules gradually being eased, those of us working have a sense of hope.
Despite the rule changes, Beijing says it's still following its zero COVID policy, just with a more flexible, targeted approach. But with vaccination rates still low among the vulnerable elderly population and authorities unwilling to accept Western vaccines, epidemiologists warn that China is ill-prepared to face the wave of infections that might come with reopening.
And to understand what that might mean, we're going to bring in journalist Fabian Kretschmer, who joins us from Beijing. Fabian, do you get the impression that people feel a bit freer now?
Yeah, here on the ground, actually, I do get this impression. At least the public life in Beijing is gradually, actually in very slow steps, resuming again. You see, testing booths closed. You see a lot of the gates that have been closed throughout the whole pandemic now opening up again. And so there's a sense of something is happening now. But there's another feeling also, and deep feeling of uncertainty, because now, because the virus policy is changing. We don't know what the next weeks will bring. Also, many of the new rules are not openly communicated yet. So, I think you have this really ambivalency of, you're feeling free, but also feeling very uncertain.
And Fabian, of what the zero COVID policy was supposed to be, really an exceptional policy, if you look at policies around the world. Was it a uniform nationwide set of rules? How does it work?
Yeah, so the idea behind zero COVID policy as it was implemented here in China was basically to eliminate the virus. And that means that, every single infection was met with resolute measures. For example, a whole building was shut down. Several hundreds of people were sent to quarantine facilities, etc. And every 3 days here in Beijing and many other cities, you needed to go to a PCR testing station to be able to participate in public life. And some of the rules that have changed, for example, in Beijing, are now that I could confirm that if you are infected here in Beijing, at least many of the residential compounds now would allow you to isolate at home. You can cure out your sickness at home. That might not sound super significant maybe for outsiders, but here in Beijing this is a huge relief, because every day we basically were going to sleep, waking up, not knowing if our building would be sealed off or whether there would be health workers knocking on our door and taking us to a quarantine facility. So there is this change happening, and it is not implemented in the whole nation. I know in some cities zero COVID is still very strictly implemented. Here in Beijing, as in other cities, there's definitely a small steps of easing up.
Okay, journalist Fabian Kretschmer reporting for us from Beijing. Thank you so much.